Hi, I'm Dr. Chad Larson. Thanks for joining me in another episode of Keep It Real. On this show, we're going to tackle all aspects of real food, real medicine, and real change. And I'm really excited today to shoot this episode in my office. This is my clinical private practice. This is where I see patients. And since we're here, I thought I'd talk to you a little bit about what kind of things I mostly treat in clinical practice. I treat all different types of people, all different ages, for a whole variety of different conditions. But I'd say the majority of the time, I'm treating patients with orthopedic issues and sports medicine. So in other words, issues of their muscles, joints, and bones. And one of the things that I focus on is joints that have become damaged and unstable, and maybe there's some arthritis or degeneration. And there's not a lot of tools in the tool bag for that. Oftentimes there's certain systemic inflammatory issues that we need to address with our diet and certain targeted nutritional supplements to help decrease inflammation. But from a clinical standpoint, there's some things that we can do to help tighten up and fix damaged and irritated ligaments and connective tissue. And there's a technique which I thought I'd talk about a little bit today called prolotherapy. Prolotherapy is it's a regenerative injection technique where we inject a certain solution into the joints, into the ligaments, and it helps them to regenerate. So it's kind of like if a healthy ligament looks like this, a damaged ligament looks sort of compromised and damaged, and it might look like this. And so what we do when we use this prolotherapy solution is we can get that connective tissue to tighten back up. And this is a great technique because oftentimes it can help to prevent somebody from having to get surgery. So this is a non-surgical joint regeneration technique, and it can be used on all joints of the body. It can be used for the knees and shoulders and ankles, elbows, wrists. It can be used in all different parts of the spine. For example, here is a model of the spine. This is part of the lumbar spine, which is in the lower part of your spine in your low back. And this is two different vertebrae that are attached together in this model. And what the model doesn't really show is that there's multiple ligaments and connective tissue that supports your low back and gives it strength and gives it integrity. But oftentimes through a variety of injuries or even a certain type of degenerative process, you can start to get damage in those ligaments and connective tissue. And that could lead to biomechanical malfunctions, and that could lead to pain and certain types of imbalances in the low back and other joints of the body. So what we can do is, after a thorough examination, oftentimes requires some imaging like an MRI, and we can start to find out in great detail what is the source of the problem and what are the areas that have the most damage to the ligaments or the connective tissue. And then with a certain blend of solution that we use in this prolotherapy technique is we could, in a very meticulous and specific way, we could inject into the attachment points of all these different ligaments and joint capsules and different tendons and some other areas of connective tissue along the spine, and we can get the ligaments to retighten, to re-strengthen, and to regenerate. And it's a very simple in-office procedure. It's relatively pain-free. Some people report just feeling the needle a little bit, like getting acupuncture or something like that. But we use a series of injections in the damaged area. And there's excellent research behind prolotherapy. As you know, following the show, I like to follow the research, and I like to really make recommendations based on clinical research if it's available. Prolotherapy, like I said, has been around for a very long time, and there's lots of good research on it, that it's good for a whole variety of of arthritic issues and damaged ligaments and joints. It's very good for mild to moderate and sometimes even severe cases. I've been surprised many times clinically where I look at an MRI of somebody's, let's say, their knee joint, and the knee is not just moderate damage, it's severe damage. And I tell them, this is to a point where it looks like you'll probably need some reconstructive surgery or maybe even a full knee replacement. And they say, well, I just don't want to do that. So I'm hoping you can try the prolotherapy and see if that works. And I say, okay, well, let's give it a shot. And I've been surprised many times that in a joint where I thought was even beyond the therapeutic window of prolotherapy, people have gotten better and they've been able to increase their function and they've been able to decrease their pain. So prolotherapy, again, is just one of these things where I want to demystify medicine and I want to demystify what the body needs physiologically. And what I like about prolotherapy is it's using the body's own healing mechanism. The body has its own way of fixing joints and ligaments. And what we do with prolotherapy is we're just tapping into that own internal system. Everybody has this. And if we can use the technique in a very specific way to target that healing response, then we can get the body's own healing system to fix that damaged ligament or tendon or connective tissue. So oftentimes on this show, I want to kind of demystify and I want to give you some other options that you may not be aware of are even out there. So from a joint standpoint, joint pain, low back pain are some of the top reasons why people visit their doctors. And oftentimes they're given painkillers. And so what they're doing in that way is you're giving somebody a medication basically just to tell their brain that their knee pain is not there anymore. It doesn't do anything to fix the knee pain. All it does is it just makes you care less about the pain. And that's not very sophisticated medicine, in my opinion. There's multiple tools in the tool bag, and prolotherapy is one of those tools where if a person's suffering from mild to moderate degeneration or arthritis, it's a great tool to consider. Medications come with a whole long list of side effects. We've heard all the scary stories about things like opiate medications, and some of these people who are on chronic use of these medications have a condition that is very treatable with something like prolotherapy. But those people just might not know that this therapy is out there and that it exists and that it works and that it could help them to not have to take these very addictive medications. And so the least that we can prescribe opiate type medications and painkillers, the better it's going to be for our patients in the long run. So I just wanted to share this technique with you. It's an excellent option, so I suggest you look more into it if this is an issue for you. And thank you again for joining me in my office. We'll come back to my office at some point in future episodes and I'll share more clinical information with you. Until next time, keep it real.